After Ella was born, my symptoms probably hit their lowest. I was living with my folks. I had to. I wouldn't be able to pick up Ella and carry her up or downstairs. I couldn't hold her bottle. In the middle of the night when she would wake up, I would have to prop a bottle literally on my arm and feed her.
My skin involvement started actually the same exact week that the pain started. The worst that it ever was for me is pretty vivid in my memory. When I was shaving and I noticed the beginning of some involvement on my face, and that is, when it's your face is the face to the world, and I speculated that I'd be a monster, and that really set me back.
I didn't know how I was going to move forward with my physical symptoms. I didn't know how I would button up her shirt, and when I could hardly button up my own. It was frustrating. It was really frustrating. I'm too young for this. I should be out running around. I couldn't.
Well, I had said, basically, I can't live like this anymore. I'm in a lot of pain, I'm very stiff, and she told me that there was a drug out and asked me if I'd like to try it. And I was in a frame of mind that I would have tried anything, really.
To learn more about treatment with Remicade, let's listen to what rheumatologists and dermatologists are telling their patients.
Good. As we discussed, it's time to consider starting treatment with Remicade. Remicade's not like any of the other medicines you've tried, and personally, I've seen psoriatic arthritis patients who've had dramatic relief in both their skin as well as their joint symptoms. I think it might make a real difference for you.
Before we discuss what results you might expect, let's first talk about how it works. As I have said, Remicade is different from the therapies you have tried so far.
Many of the medications are designed to treat either the joint or the skin symptoms of your condition. Remicade actually targets the underlying cause of the inflammation in the skin as well as the joints. And that's what produces the painful symptoms you're feeling. When the immune cells are activated, they release a protein called TNF-alpha. And when TNF is released, it triggers an inflammatory response in both the joints as well as the skin. Remicade targets TNF-alpha. The medication actually binds to and neutralizes TNF. By targeting TNF, Remicade can help relieve both your pain and swelling of your joints, as well as the lesions on your skin.
Go fast.
Because it can significantly relieve these symptoms, Remicade may give you back the freedom to perform many important activities of daily life.
After I started taking Remicade, I could walk down the hall and not realize I'm walking, in a sense, that because it didn't hurt. It's like breathing. It's just what you do. And when there's no pain, you don't think about it.
Everybody is different, so results can vary. What I can tell you is what others have experienced.
According to studies, many psoriatic arthritis patients begin to feel better in as soon as 2 weeks. Sometimes patients feel dramatically better, and by this I mean more than half of the patients in the trial for Remicade experienced significant improvement in their arthritis symptoms. This includes a significant improvement in swelling and a clear reduction in pain. As far as skin symptoms are concerned, 2 out of every 5 psoriatic arthritis patients on Remicade experienced 90% improvement of their skin clearance.
It wasn't even in my consciousness that there would be skin clearance. And for about 3 months, there really wasn't a change. And then, over about a 2-week period, it all just disappeared. It was gone. And that was very exhilarating.
Remicade, like other medicines that affect your immune system, is a strong medicine that can cause serious side effects. Read the safety information here to learn more about what you should know before beginning therapy.
Remicade is not for everyone. Only your doctor can decide if Remicade is right for you. Remicade is a medicine that can cause serious side effects. These side effects have included serious infections, some of which have been fatal, including tuberculosis, TB, and infections caused by viruses, fungi, or bacteria. Your doctor should assess your risk of infection. Tell your doctor right away if you have any of the following signs of an infection while taking or after taking Remicade, such as fever, cough, flu-like symptoms, feeling very tired, or warm, red, or painful skin. Tell your doctor if you have hepatitis B or if you are a chronic carrier of the virus. In rare cases, some children and young adults with Crohn's disease treated with Remicade have developed a rare type of cancer called hepatosplenic T-cell lymphoma, which often results in death. These patients were also receiving drugs known as azathioprine or 6-mercaptopurine. Tell your doctor if you have or ever had any type of cancer. Many people with heart failure shouldn't take Remicade. Other serious and sometimes fatal side effects reported in patients taking Remicade are heart failure, cancer, liver injury, hepatitis B reactivation, blood problems, and nervous system disorders. Infusions with Remicade may also cause serious allergic reactions, including hives, difficulty breathing, chest pain, high or low blood pressure, fever, or chills.
You should read this information before you start using Remicade, and also again before each time you are scheduled to receive therapy. If you don't understand anything on this sheet, feel free to ask me or my staff.
Okay. Well, can you put your bear down? So I feel really fortunate that I have Remicade to allow me to get Ella ready for school in the morning, so I can get myself ready for work every morning. We can go to the zoo and walk around all day long, and she loves it. Got your nose. And I don't have to worry about it.
To make sure you get the full strength of medicine, you'll need to receive Remicade through intravenous infusions. And I'll calculate and customize the right dose based on your weight.
I'll be back in a minute.
The infusion takes about 2 hours, and it happens in our office or in another infusion site that's convenient for you. We try to make sure the experience is as pleasant as possible, and usually after 3 initial doses, you only need to receive Remicade as few as 6 times a year.
Okay, Lisa, how you feeling? Good. You doing okay?
I had never had an infusion before, but as it turns out, it's really not a very memorable experience at all. I mean, which is really what I want out of a procedure.
I eat my lunch and do my crossword, and it's so.